You did?
Yeah.
Mm-hmm.
So you got it.
Okay.
Of course.
And
After you do.
how
Oh my god, my back.
how do most people kind of go through with the acne scarring? I mean, do you feel that you get a lot of primary acne scar consults, or that most of you guys get the referral from the physicians? How does that? How do we streamline it, and do we streamline it well enough? So in other words, is the front desk making the appropriate referrals for consultations?
Yeah. I really get split. Like I'm getting provider referrals, but also a lot of the time it's candidates who have like some ice pick scarring going on more so. So I always have to kind of refer back to like TCA cross and that sort of thing. So.
And now, next question is actually to Bao. When you do your 4 passes, do you feel that the ice pick scars are responding by treatment number 4 or so?
I love them a lot for rolling scars also, especially with girls, because once they put makeup on, you notice a much more dramatic difference with the acne compared to the lasers. Ice pick scars, depending on some of them, on the larger one, I feel like maybe with the infinite definitely a little bit more. But the little ones is really difficult.
Really
At this
difficult,
point,
right?
either if they're the right candidate, then I'll just refer them back to the provider for the TCA. But I don't promise much.
Who is doing TCA here?
Dr. Bird, Dr. Hanaway. Does Dr.
So
T
Dr. Hanaway, yes. Dr. Bird, I think she expressed, I don't know if she's now back into doing it, but she expressed that she no longer wishes to do them. She did for one time, and then it did not work out for her, and I think she's not the person to send for TCA, but definitely Dr. Hanaway. And I don't think Dr. Gonzalez is doing TCA cross either. So it's really Dr. H in Philly, and I'm doing it here.
Are you just doing, who does subcision?
She's the main girl.
I think Dr. Hanaway also, not only
Okay.
I think, Dr. Hanaway also does subcision treatment. I felt that I heard that Dr. Gonzalez might be doing it, but I'm not 100% firm on it, and she would want to see the patient definitely beforehand, so it's going to be a little bit more difficult just sending to her. In any event, I think a patient should be evaluated to see if subcision is really the right treatment.
Okay.
It's a barbaric treatment, very bloody, lots of bruising, but really good results actually in the right patient, and who has the downtime to go through that. There is a risk of infection, because we're creating this plane underneath the skin. The blood can pool. Bacteria could theoretically feed on that. Doesn't matter that we are so careful with the antiseptic that we're applying to the skin. Ultimately, there is a chance of infection with that. I've produced one infection in my life in subcision treatment, so I think it can happen.
Do they have to take a cyclovir for that, or is it just the?
No.
Okay.
It's like the heat, I think, from the
The
laser.
Off topic,
Yeah.
not scars, but since we're talking about the providers, I had to reach out to Dr. A because I had a patient here who was interested in medication for melasma. She doesn't do it. I know that Dr. Bird does it and loves it. Is any other provider doing that?
Doing what?
For melasma, sorry. The medication. Tetra
What
something
medication?
acid. I can never say the word.
That big
Tetra
fancy
something
Latin
acid.
word.
The medication for melasma to help.
And Dr. A is not prescribing it?
She doesn't like it. I don't know. Dr. Bird does it. I know she loves it, but
What's the name of it that was?
Tetra something acid.
Tranexamic acid.
Yes,
That one's completely off. I don't know how you
Had the
didn't
tea
remember
right.
that.
That's okay. The tea was good.
And the acid.
Right. So, are you sure that Dr. A is not prescribing tranexamic acid?
No, I wrote her an action about the patient because she was around this area, but she said that she does not familiar with it, or she doesn't do it. Dr. Bird does it.
Strange, right? Looks like I should be doing a little education. I actually sent an email right when I came from that meeting. I'm going to just recycle that email. How about that?
No. No, she's not angry.
No.
She'll CC you on it.
Yes.
According to Bao.
No, I'm not going to write it this way. Just gonna, little refresher. I'm going to have to say, when at the meeting when the tranexamic acid was reported a year and a half ago, it sounded all amazing, and nobody's going to have melasma anymore when they take tranexamic acid. But that's not the case. I have a number of patients on tranexamic acid, and I think there's no progression. There are some in whom the melasma may be slowly moving, but by and large, I'm a little underwhelmed with the results of tranexamic acid, which is not to say it doesn't work. And in the dose that we're giving it, it's definitely a benign enough drug that we're not finding anybody with adverse events, no thrombotic events, although it's actually constricting blood vessels. And this is how it's improving with melasma, because it doesn't allow the pro-inflammatory cytokines to flow through the skin and inflame the skin and then causing the melasma. But I have really not been very there were no smashing results, put it this way. And some of my patients have elected to do the 3 months treatment course, which is one way of treating, and others have elected to not stop it and actually take it continuously. And I have a few patients who are now already on a year. Again, they don't do any better than the ones who've only taken it for 3 months. I think it's a good adjunct, but maybe there's something more miraculous needed than that. I've also used the pulse dye laser in a number of patients, Dana as well, in a number of patients with melasma, and in some it works a little to support, and they will say yes, it made much of a difference, and in others not. And it's interesting that those with the tranexamic acid kind of non-response are also the one that have non-response with pulse dye laser. So maybe eventually we'll learn who is that person who can much more benefit from it.
Are you guys doing pulse-dye laser also for melasma, just with rosacea, or melasma by itself?
Melasma by itself.
Oh, okay.
Just melasma. Right? I mean, because if you constrict the blood vessels, whether it's with tranexamic acid or pulse dye laser, it's the same. If you have somebody who is skin type 4, it's really, really going to be difficult to... We spoke about the treatment settings at some point of time. Do you still have those? A long time ago.
PDL for
so
melasma
this is only from
Yeah.
1 to 4. Right?
So 10 millimeter, it's supposed to be 6 milliseconds and 7 joule, and that's for skin types 1, 2, and 3. You can do 6.5 joule, and then you have to go probably a 2 full joule down if you have somebody with skin type 4, and you also have to pray a little bit that they won't have to hyperpigment. So be very careful, that's the bottom line, when you treat somebody with skin type 4 and you try to use these settings. I think in the Northern Asian patients it's a little easier to use that compared to the darker Mediterranean. I think there it could be a little bit of a challenge not to get hyperpigmentation. So you're going to be operating the same 10 millimeter, 6 milliseconds at either 4.5 or 5 joule per square centimeter for the skin type 4.
I have a question about a patient I've been treating. So she did 2 mini melanage peels, and she did a pico, and she's on the melanage brightening cream right now, and she's having really good results. I just saw her for her second pico, and I noticed on her photos it looked like there was some regression. So I had asked her, I'm like, she had told me that she stopped her brightening cream, and I didn't know that. So she probably was off of it for 4 weeks. I guess my question is, obviously you can't be on the brightening cream forever, so what would you do if she's having it come back just like that?
So normally everybody with melasma needs something to suppress their pigment, and you're right, we want to use Arbutease or hydroquinone only for a 6-month stretch, and then shift them over to 6 months of something else. There are many substances that help reduce pigmentation. Vitamin C is one of them. Glycolic acid, kojic acid is much more powerful than any of those. Then there are some liquid root, Embellica, what have you. The combination product that we have in the melasma emollient has 4 ingredients inside, right? It has azelaic acid, kojic acid, vitamin C, and lactic acid. It's so that they're already all working together to do that. So the key is to switch them over right away, to never really let them be without anything that suppresses pigment production.
Okay.
Because if you allow their skin going from arbutase, let's say 4%, you haven't even tapered it down to, let's say, 3%. This enzyme is coming back with a vengeance and wants to do what it wants to do. You need to inhibit this tyrosinase. And for that, I think you want to, once you have them at a really decent level and you feel like time is up, you need to shift them over. You cannot really let them go bare. It's not a good idea. Some people call this a rebound phenomenon. Mm-hmm. That's why we also want to aim, when we are using arbutase at a high percentage, that we want to aim a taper down so that they're not moving into the rebound. Okay. Now, I hardly ever see 3% arbutase in anything. I don't know if you feel like it's not doing anything, but actually as a tapering tool, it works really, really well, right? I mean, if we can see our patients through and go down, then they can seamlessly go into the melasma emollient, or if they just want to use all these products separately, they can use a vitamin C, they can use an azelaic acid on their face, they can use a kojic acid on their face, but in the melasma emollient, they have it all together. Right? There are a couple of combination products available on the market, but most of them have maybe just 2 or 3 ingredients, and there are not many that have 4 ingredients at the same time.
Did you end up looking at that Teresa Larson, that Roots comment that it was getting the results that you might desire?
Yeah, I mean, I think she does not yet have the results that we're looking for, that's for sure. Right? But, I mean, there's also some holdups. You know, she has the scars and she has all these bumps everywhere. I think it's not an easy treatment. I think it takes a lot of hand holding, and eventually I think it will go in the right direction.
Yeah, obviously, I'm asking you for pictures, right? Once a month. I'm going to sit on you and I'm going to get it. Now, I don't want you to send me just pictures, but even these just pictures can help, because you see, you ask, why don't I have enough progress? You get an answer. So please, every month, at least one set of pictures. Even if you don't have the ideal ones, any picture will do it. I will appreciate better pictures than not, but everything is going to be acceptable. But I do want from everybody, every month, set of pictures.
And you just want the name and the date, or are we?
Right, you just give me the name of the patient, the procedure that they did, how many treatment they had, and that's it. I will take the pictures. I find it very, very helpful to have this input from you, those pictures. It serves us in many different ways. It helps us in see how treatments affect our patients and kind of share it with others. It helps us communicate it to the physicians that refer to your patients. If they see that you have a treatment that actually has results, they are going to be more inclined to send you patients. And also to educate them. They are not always aware of all the lasers that we have and all our capabilities, and this is very helpful for us to be able to educate them through those pictures. Also, it helps us with social media if we have the permission to use the pictures. According to Francisca, we cannot use it if we have no permission, unfortunately. But are you sure?
Yeah, 100%.
Even if I just take without identifying anybody?
Yeah, if the eyes do not show and you're not blinding the eyes, then you're good.
If
you're blinding the eyes, then you have to have permission of the patient.
No, I gave you a picture without eyes.
Good.
and you still say that we need the permission. So ask for the permission.
But I mean, those patients who have these amazing results, they are oftentimes more, particularly if these were birthmarks, or something that really bothered them, they're oftentimes more inclined to even giving permission because they're so happy that that something has worked, and then they really believe that others can benefit from the same, and so they're usually very, very
You have
much.
to keep asking. I mean,
Do they have to
everybody.
sign something?
Yeah.
Yeah.
Oh, really?
I can
Is
show
that
you.
in the,
Yeah,
okay,
it's in
because
the
I
tool.
have someone did that.
Even email is good enough. Just send me the email and it's good enough. Usually for me it's even less than that, but
What about the people who refuse pictures?
Yeah, I don't like to treat them.
Okay.
There are patients who I would say, without being able to take a photograph, I do not want to perform a treatment.
Okay.
Because I need to check treatment progress.
not every treatment. If someone comes for facials,
I mean, I have
Well, there was
one
like a
guy who's
tattoo.
adamant, like,
Who is that?
his name's David Carney.
And what does he want to do?
He's gotten several things. He got a tattoo. He did let me take a picture of the tattoo, and he had a scar right here, and then there was like a cherry angioma on his nose. But everything was fine. But he was like nasty about it almost. He's like, I don't want
Nasty
it.
about all of the photos?
Yeah, he
All of
refused.
them.
He refused to do. He let me do the tattoo.
What about the scar?
Mm.
I would say, I'm very, very sorry, but if I
Okay.
cannot check my work, I shouldn't be touching you. I don't believe it's ethical for me to treat you.
Okay.
This is your answer. And that's for everybody. If somebody gives you a hard time and you feel that you really, you do need to check your work. You need to see if something is moving. You cannot just say, okay, well, let's just do this, let's just do that. But if somebody's giving you a hard time, just say, I don't believe it's ethical for me to treat you. Right? That's what you say. That's a good. Patients are not taking it in an offensive way. They just understand that you do need to check your work, and if you don't have the ability to do so, that you better really not start the treatment. Right? I have no issues with that. Somebody who is not allowing us to do our job to the best of our abilities is somebody who we really shouldn't be treating. There is no such thing as, okay, let's just do a treatment, right? So every scar needs to be checked, needs to be photographed before, not 5 times into the treatment, but at the start of the treatment, a tattoo needs to be seen. We do need to have some sort of way of saying, okay, are we doing the right thing here? Where do we need to improve? But every time I'm seeing a request of, can you help with this one? And I'm seeing no pictures. I just don't know how I'm going to comment. Right? I have no way of inputting there. And I wonder, if we have no way of inputting there, why we don't want to check ourselves. We want to stand for quality. We want to do the right things. We do want to do the best we can every single time.
apropos pictures, obviously now I see your pictures and I see that some of you needs to improve your techniques of taking pictures. I will spend some time with you, but I think the common mistakes that most of you have, I just touch on it now here, so you will kind of be a little bit more aware. When you are taking the 45 degrees picture, it's never the same. And what you need to do is try to have the tip of the nose align with the cheek. This is 45 degrees for you, right? Unless it's a Chinese patient, then it becomes almost 360 degrees because they have the nose is very small. Then but then you have to have approximately, okay? But cheek, nose, cheek.
Well, at least then for that patient, it will always be the same. Whether it's truly 45, probably it doesn't matter. But for that patient, it will be the same photograph.
Right, and also try to, when you take the pictures, try to make sure that also the colors are correct. There was a period of almost 6 months that one of the cameras were on the wrong setup and all the pictures were blue, like you are there. And
They don't see themselves as
they do see themselves, right? You see yourself blue, right?
You're like Smurfs, little Smurfs.
Right, so I need to make a lot of adjustment before I manage. The pictures that I actually send on Instagram lately, they were totally different, but I was able to adjust the colors. But check it if you are not sure, call me. It's a very easy setup. I don't want you to be involved because it's kind of...
How do we check whether the color filter is off? I mean, I was thinking there's something that's different with the camera, but I'm thinking you're checking the camera all the time.
Yeah, I'm checking it every once in a while. When I see pictures, somebody moved it, then I go back to fix it back. Actually, the software is supposed to fix it, but it doesn't, so it's not foolproof.
Okay. Alright, so if we notice something unusual with the colors, we're
And
gonna
spend
mention
time
it.
with the camera. I mean, more than one picture. Very often I see you're taking pictures of the face. I see 2 pictures. No templates, not using any template, just kind of to have 2 pictures, and I don't know how you get to it, but use one of the templates and follow up with it.
Sure.
Follow through with it.
Are you, is that photo room over by the front desk staying there with all the renovations?
Yeah.
I didn't know if it was moving. The other one has a little stars on the wall and all these cute things.
Okay, do we need stars on the wall?
It's so pretty in that one.
You can also take the
You can make the stars for the other.
Right. Okay. Alrighty. What other issues should we discuss?
let's discuss Bao's eyebrows. Is microblading or this is
No, I think we should discuss her lips.
Oh my god, no! What happened with the lips?
No.
I did my eyebrows too much Botox.
No.
Uncle Bird did my lips last Thursday.
Yeah,
On the Botox.
yeah.
My lips looks horrid that night. It was like 3-4 times the size, and now it's 2 protruding here, so I look like toothless when I smile. I can only see a little bit of the tooth there. I didn't know that she was gonna put anything here. I only wanted a little bit here to try. I think she put too much. I don't know. We're waiting to see if it dissolves. If not, I need help by the end of this week.
Good
My
thing is that
husband is calling me toothless.
Good thing is she went on vacation for a week, so the natural follow-up will be 2 weeks later.
And then the Botox, no, she did
Discord.
Mhm.
It was like, that's why I was like, are you talking about my eyebrows?
I really did because we were talking about it earlier. I'm like, oh my gosh.
self-conscious
Baruch
enough to
knows.
look at me.
I noticed everything.
You do.
He's been trained well. But yeah, I think it was bruised here, and then here, she did here where she usually didn't do. So it was very protruding. It looked like I had an implant there, so this was spread out. And my forehead was like larger than normal.
Val had a good weekend.
Thank God it has worked.
She still came to work though.
Yes, Friday. I text Julie. I'm like, can I go out? I'm like, my lips looks ridiculous, but.
Did you actually called out on Friday?
No, I didn't. I was texting Julie that I was like horrified that morning going into work. Don't look at me, Julie.
Lucky if did you see Mindy? After
Oh, yeah.
Oh my God.
she was
There was
We'll all remember that.
she was from Mindy.
Were you here then?
Everything.
Mindy?
I was here. I was like right before I left when it just got.
Yeah.
I didn't get to see it repaired until I saw her in November, and in my mind I was like, oh my gosh, it looks so much better, but I didn't say that.
So we'll get to you in a second, but but let's talk about you. So I have a discussion with Renee about microblading, and she said that she heard that microblading is not a good idea. Many patients are not happy with it. Blah blah blah. This is microblading.
This is ombre.
What is
I have
it?
also microblade before. I think it depends on the patient. Microblade is a little bit more permanent. Ombre is nice if you have eyebrows already there, but it's a little bit sparse or a little bit light, so it gives you more like a makeup touch to it. Microblade is better if for someone that has no eyebrows like myself, so it lasts a little bit longer and is suitable more for all skin type. Ombre is only suitable for certain skin type. If you're like too oily, sometimes it just dissolves faster.
And what is
what I
ombre?
heard. Sorry.
I mean, what substance do
It's,
they use?
I don't know exactly, but it's more in a powder form, so it less strokes, more powdery. So it looks like if you would have like done your
How often do you have to do it?
I'm not good, but mine has been about 6 months.
Wow.
But
No.
typically, yeah. So you do one, and then you kind of they do like maybe minimum only about like 40% of the pigment there, and then you come back again in like another month or 2 months, and then they touch up whatever that's not there. And then depending on the person, how oily their skin is, usually it'll last for about like 6 months, a year.
So I thought microblading, I had heard, oilier skin types, it doesn't do well.
Yeah, so certain
Microblading,
skin
yeah.
type with the microblade. I think the ombre, it depends on, honestly. I feel like oily skin, nothing ever
Has
stays
it,
as
right.
well. But the microblade has a more definition if you have like no eyebrows. Ombre is nice if you have a little bit there, but I only wanted to try it just because I've never had it. I like microblade more.
Oh, you do like microblading more?
It depends on who you go to.
Yeah.
Right. And then how did you hear that microblading is not so good for some people?
Well, I have people in my life that have trained to do it, and they went back to more of the permanent makeup.
I would never do permanent.
But it's not just for makeup, it's actually,
With the 1 megahertz, that means the speed in which you deliver everything is a little faster because it's the 1 megahertz difference between in the firing, and so you are not downgrading the treatment by operating at 2 megahertz, or if it makes it more tolerable for the patient. So much more important is the energy level, which is the levels where they're not giving us the exact energy unless you kind of calculate where you are, but where they're saying level 6, level 7, and so on and so forth. But that's the most important factor for the overall success of the treatment. I think what's really, really important to understand for the success of the treatment is that if you want to tighten skin, it is going to be difficult to make it work where you're only trying to tighten in the deflated area, in the area that has the most solar elastosis. I've come across a couple of treatments where a patient had Vivace to the jawline or Infinite just simply to the jawline, and that unfortunately is going to not provide the patient with the superior results, because you're working strictly in an area that is so badly sun damaged that you don't really recruit the tightening from anywhere else. You have to go higher. You have to basically grab from that upper portion of the cheek also. If possible, if that's a person who has bad solar elastosis, you want to grab from the neck area. You want to talk the patient into doing the neck as well, and treat completely rather than just a strip here. Somebody asked me for a code for that, and I thought, we shouldn't really have a code for that, because we do want to really tighten the person's face, and they're getting a little bit too little if we're just confining it to here. Right? I mean, we're not taking advantage of an overall contraction. Right? How has the sales process been for the people with Vivace treatment? Have they been sort of accepting? I mean, my patients seem to be wanting it. I say it, they do. They come, they are on your schedules, and they don't blink, and they don't say, oh, it's too expensive, or, But how has the sales process been for you guys?
I don't think
Pretty
anyone's
good. They like that
there.
there's less downtime and less pain, because a lot of people got scared when they would hear about the Infinite.
But is somebody saying something about the price of the procedure? Do you feel that there are many who are not going to go through with it, or have you had very little where you were doing the primary consultations?
I haven't had any
rejuvenation that haven't come to me through you or another doctor, but it's very easy for the acne scars.
Right.
Working.
Well, but for the acne scars, it's easy because it's a standard price for everybody, right? Nobody complains about the $500 investment. At least I have not seen a single person. I mean, it's very competitive. I don't think they get it in other practices in the same way. And obviously in acne scars, you should be treating focally to the acne scars, because that's not a rejuvenation process where we want to get an overall tightening of the skin, right? We want to have a repair of the acne scars. We want to go as deep as we can. If you have a starting point, if it's possible at all, if you are on the cheeks and they have that's not over a bony area where you have to be a little bit more careful. Please aim right away for 3.5 millimeter depth when you're using the Vivace. Don't even bother with just 3 millimeter. You want to go as deep as you possibly can. And try to aim for 3 layers, 3.5, maybe 3, maybe 2 afterwards. I don't know. Everybody's a little bit different. You see the scars, you have a good sense as to how you need to crank it a little bit.
Do we have any feedback so far?
I was just, who was it that was saying, Kristen, you had bumpiness from,
Sorry, it's cutting out.
did you have bumpiness for after, like as post Vivace?
And then she said the next day she was fine. It was Margaret. But she reached out and said that it went down the day after.
Oh, okay.
No, maybe she had
Margaret.
a hive-like core. Maybe she had a hive-like reaction, kind of now in hindsight, because it really went away the day after. And she was so stressed also on that day after the procedure. I'm wondering if that had something to do with her reactivity altogether, right? She had a family.
When she was checking out, she got a text that her nephew was in the hospital, and I think that's what her family emergency was.
Okay.
It was immediately after.
Okay.
So she didn't look that pink when she left. I mean, her forehead was a little pink, but a lot went down with the mask.
Yeah, I think her adrenaline level gave her a run for the money there
Mm-hmm.
as well.
When should we expect to have some results? Kind of, obviously, to compare it to Infinity. Are we in a position or not yet?
Well, I had the model in this come back, and she had already seen results, she felt, and then she's coming back soon for her third treatment.
She did feel something.
She felt like she.
My client as well, we did acne scars, and she said she could see results already, and she'll be back soon for her third one.
Yeah, and I just did an acne second, and she was so excited. The one you did the microderm on, she was so excited by the results and has had several other laser
So are we
treatments.
only seeing results after 2 treatments?
I mean,
or
the
do they
acne,
see it
she
after
saw it
one?
after one.
Really?
Yeah, after her first one.
And she peeled, which was strange to me. She got peely, but she didn't have the track marks like Infinity.
Oh, that's nice.
Yeah.
Because we were
I know, wondering that if it has
hesitant with
magic.
the results. I think
Yeah.
it's good to know.
Yeah.
Okay, peely, and it was not the graininess from that little kind of scabbing. You actually saw peel.
Well, you
Did she
did
show you a
the.
photo?
Yeah, I mean, it wasn't like severe, it's just more so like flaking. But it looked really good. I mean, it wasn't like in sheets or anything like that. It's
Okay.
flaking.
Like dry peely.
Yeah, like dry peely, yeah.
Okay, good.
How are Infi doing in Philadelphia? Do we sell it? Did you take the handpiece for the erbium?
I didn't give her any instructions.
Can I get the Vivace chart real quick? Because there was something I saw that seemed strange on it.
Okay.
I've been doing 4 passes for the entity. Do you think I might overdoing?
I'm not sure. So, when we're using fractionated radiofrequency, we certainly knock out a lot of tissue, a lot of elasticity at that time. I have to put glasses on just a second.
Yeah.
And so you could theoretically be overdoing it if you're doing it too frequently and don't allow the skin to heal in between treatments. So I think it behooves us to not doing treatments any sooner than 4 weeks. We might even have to increase the time spent to every 6 weeks in order to assure that we're really not knocking out the collagen fibers in a way that they can never find themselves again. I think I told you guys about this one patient who had radiofrequency treatments, in case not everybody has heard it, to her thighs and buttocks. She had them every 3 weeks and she had 5 treatments, and 6 months later there is no elasticity in her skin at all anymore. It's hanging. And she didn't have Infinity. She had whatever, I think, Excellis. But it's radio frequency, and unfortunately it knocked her connective tissue out, and hopefully it will come together, but I cannot say that with 100% certainty. She's a young woman and the skin is just hanging down, right? Sad.
So I thought this was strange. Here they recommend 2 only for skin rejuvenation.
Right, because you don't want to pester your patients as much, but you can use 2. It's not a problem. I mean, I guess again, if you maybe with the others, when you're using, let's say 1 megahertz, so let's say for scars and so on and so forth, and you want to drive the energy quick, right? Then maybe there is something to it, to heating the tissue a little bit more, whereas for the rejuvenation you don't need to do it as much.
Okay.
But ultimately, between the 1 and 2, it's really mostly a comfort thing, and it's not so strict to be absolutely having to do, let's say, we can do 2 also for acne scars, but if they can tolerate it, let's do 1 megahertz.
But it seems like they say only, never to do 1 in a way.
Okay.
Is it? I mean, I didn't understand.
Probably it's a matter of comfort, because if you're supposed to be doing kind of a nice treatment, and then you might not want to inflict anything.
Anything.
Right? I think it's mostly because of that,
Okay.
not because you do something different to the collagen.
Okay.
Okay. So how's Infinity going in Center City?
I love it.
Still strong? Okay, tell us about your 4 passes. How do you arrange your passes?
It depends on the patient. If someone has like really deep scars and this is on their 2nd or 3rd, I will usually try to go in deep, so I'll do 3.5 millimeter. Depending, I either will go between the second one, 3 or 2.5, and then I taper it down to 2, and then 1.5.
Mm-hmm. Okay.
And then now I'm doing 3 on temples as well.
Mm-hmm.
3 passes.
Cheeks is the only area that I do 4 passes, but usually with Infinity I only do them 6 weeks apart. I never do them 4 weeks apart, and there's only 2 back to back. No more than that. And then after that I rotate them on other lasers. But I still love my Infinity, and we're still pretty busy with the Infinity there. Right,
Yeah,
guys?
I've noticed that. Has there been any advantage to the new pain regimen?
Yeah.
Do you feel patients are tolerating it better with the Tylenol and ibuprofen combination, or?
I feel like it's just the patient, honestly. Some of them forget to take their medicine sometimes and still wrote it out and was fine with just the numbing. Some people, I put them on Percocet and Xanax and they're still like, freaking out during the treatment. So it's just depending at this point their tolerance for it. But no, I love my
I had somebody yesterday who I'm treating for melasma with the Pico, and it's, sadly painful, I'm going to have to say. And she clearly said it was so much easier when she took the ibuprofen and Tylenol combination. Made a huge difference for her. And, it's an uncomfortable treatment, but she said it was much, much better. She still needed 2 squeezy balls, but
Are we prescribing this too? I mean, what is the pain
Oh,
regimen?
the pain regimen is now different than we used to before. So we no longer do ibuprofen 800 milligram, but the studies show that if you do ibuprofen 400 milligram and combine it with Tylenol, either 375 or 500, and you take this about an hour before the procedure at the time that you put numbing medicine on, that you reduce the pain level much, much better than either ibuprofen at high dose or Tylenol at high dose or any of the codeines.
Okay.
And so that's been a major advantage in treatments. And so you instruct your patients to bring those medicines with them,
So
that they can take
they're
it.
just using theirs at home. Oh, okay.
Things with eyebrows, I think, and then you can cover scars. You can actually treat, skin tone, create like the things that we can't get with lasers or after surgeries. You can actually.
Just make sure that you don't pico them afterwards, because you turn
Yeah.
everything black again.
That's scary. Right, we had that.
Yeah.
I don't know. The woman I just recently spoke to, she said that she was getting a lot of return clients that weren't happy because the results you couldn't guarantee. But I mean,
Interesting. I've only
She's
had really super happy patients with microblading, or maybe the ones who were not happy never said anything about it. But the ones who've had it, and I've known them for a long time, they were really, really happy with their results. But they were also very particular about where they went to. They went to somebody with
Yeah, I
a lot
think-
of experience.
Yeah.
Somebody
it's
who had
hard to
been.
find a good microblader.
Right, okay.
Deanna got it done.
Who did?
Deanna.
Diana also got it done.
Yeah, but Deanna said she didn't like hers at first. She said they were kind of uneven. I didn't see a difference, but she was unsure about it.
I don't see any unevenness on her
Yeah.
face.
I just
Okay.
wonder where you get trained in order to get the right training to be able to know.
California.
Yeah.
All the good ones go to California because
To
they're always
who?
so behind on everything. To California.
And so that's where you do.
The main
where you-
ones, but a lot of people now said it's Bobby. I think I don't know what happened. We were like looking into it for to go, and then it kind of stopped. But I think I found like 2 that was pretty decent. But it really depends on like the person itself, like the technique and stuff like that. I don't know.
Yeah, I mean, I think I was always interested, and then I just heard. I've had clients come in that were not happy.
I just need to see you
I
before
think
you.
like that first time you go there, it's deceiving because it looks so perfect, and then it's
It looks darker, actually. It's horrifying. I'm like, are my eyebrows gonna stay like this? But it gets really dark and then gets really scabby. And that lasts, depending on the person, for like about a week. And once that comes off, at least like you only have again like 30-40% of the pigment there, so it doesn't look like dramatic. And then you come back again, and if it's a good artist, then they'll know how much it does. And some people overdo it on the first time, and then it's too much ink dip, and then you can't take it back. So again, I think it depends on where you go. I love microblading, especially if you don't have time for nothing else for yourself. It
Yeah.
saves a lot of time, and it's minimum because it's only like 6 months to a year that I need to do anything. It's probably been way overdue, but it makes my life so
Or
much
they do
easier.
look good.
Well, now it's super arched because of the back.
That's what Ray was talking
I
about.
know, my
No, it's because
Excellent
of
art.
it's because of the display. If it was Botox, it would be good.
I had Botox before and it was totally fine, but this time, like, I was so traumatized with this that I didn't even realize this. And then now I have like one big giant bruise here. I'm like, oh, wonderful.
Don't even see it.
And now I can't even smile the pictures yesterday I took my son out for pictures and then he, oh my god,
Are you
it's so
talking to-
bad. I'm like trying to hide it and not talk to it. But in the picture you could see, I literally had, it looks like I had 2 little baby tooths sticking out through the slime. Like, this is horrifying.
It
They
will
won't
get
go
better.
away.
It will get better. Don't worry about it.
Yeah.
Okay?
You're going to be wrinkled again.
At this point, I'd rather be wrinkled than toothless.
Thank you so much.
Oh.
Pull it
Slap
off.
me next time I do stuff to my face. He's like, what is wrong with you? I don't know. It's in my field. I have to. It's a mess.
So funny.
Okay. Oh my god. Botox was totally fine. I think she just maybe, I don't know. Maybe it just didn't take well with this word. I don't know.
Beat you up.
I wonder how many patients like you we have that sitting down and
Just
complaining.
waking up, crying. Oh my god. How like normal people just keep getting it done and just look so bloated. Like, what's that woman name? Andrew something? I think she's Middle Eastern. She only goes to Center City now. Oh my god. I saw
Oh
her
yeah, the one who has the many no-shows, right?
Yes.
Oh, I remember her.
Oh. Have you seen her recently?
No, I haven't.
Oh my gosh, she looks like her face can't move and her body can't move. She just looks.
Oh wait, I know
bloated.
her. What's her first name?
You know her.
Andrew.
Like the pear?
Oh my gosh.
It's ridiculous.
She used to come to me for lashes.
Oh my god. Oh
Okay.
yes, and very overdone.
Oh my
lashes.
gosh.
And she has a facelift. Her
And
face
she's
is-
beautiful.
She doesn't.
And she doesn't need any of
You know, I'm
that.
like horrified with this. I'm like, can this go
Oh
down
my God,
more?
you're-
But her lips are like super full. She has like all these working.
It's in order to
Full
distract
gown when she
herself
comes in every time.
from the melasma.
Oh yes, she has melasma, and then she said she has a birthmark here, which I'm actually scared to treat her with anything.
Don't.
She's like, should we do PD? I'm like, I think we should focus on your melasma and not do that, but.
I think I tried to treat the birthmark,
She's a
years
lot.
ago, many years ago. Didn't work. Don't
She's
treat it.
nice, but she's a lot.
She's so sweet. But she used to come into the lash place I worked at. She had no lashes left, and she'd be like, "I want them really full and really long." And you're like, "Oh my God, I can't do this to you."
So all the
She's like,
spa,
"Not
all the
yet."
spas in Philadelphia know her.
Oh my God.
Probably so.
Yeah.
Oh my God, it was so sad because she doesn't even see her natural beauty.
Ready to smart you.
Okay, guys.
All right, good.
Thank you.
Thank you.
Thank you. Philly, any questions? No? Nothing? You were so quiet. All the action was here.
Because they're blue.
I know.
Pending we're there.
Okay, all right, thank you.
Bye.
Bye.
Oh, how?
Oh man, did you see that?
You wanna